Okay, well, we'll make a start, everyone. A huge welcome to you all. For those of you that I haven't had opportunity to meet before, my name's Gemma Stacey. I'm the director of the Florence Nightingale Foundation Academy. And we run these webinars on about once every fortnight basis for our alumni and for our members. But we were so privileged to have the opportunity to host some webinars, a series of webinars with the senior leadership team at NHS England and Improvement around the whole topic of developing political acumen in nursing and midwifery. So we wanted to share this knowledge as widely as possible, and we've made this particular webinar open to those of you that are within our community and interested in this topic. So you are really welcome to be here. It's wonderful to see you. For those of you who have just joined, you're very welcome to pop your cameras on. There'll be lots of opportunity throughout our next hour together for you to ask questions and to join in the debate and the discussion. We fully intend for this to be interactive. You may have noticed already that we're recording the session, and we do that so we can share the session widely through our social media channels. If you do ask a question and following the session you would prefer for us to edit that question out or your input out, just drop a line to the Academy team and we'll be able to do that before we make the link live for everybody to see. So without further ado, let me introduce you to our session today. So we have with us Duncan Burton today, who is the Deputy Chief Nursing Officer at NHS England and Improvement. So Duncan and I have worked really closely together in his role as Director of International Nursing Recruitment, but more recently his remit has expanded into workforce and also maternity operations. So I'm absolutely thrilled to invite Duncan onto this session today. He's somebody that I see using political acumen in his day-to-day work and influencing in his role, but also offering platforms continuously for the people that he interacts with and work with him and his team to have their voice and show their influence. So I'm really excited to hear what messages he will share with us today. And he's going to start off our series around political acumen on understanding policy development. So I'm going to ask Adam to share the slides with us, and I'll hand over to you, Duncan.
Thanks, Gemma, and lovely to be with everybody this morning. That was a lovely introduction, actually, and hopefully I can live up to that that request, actually, to be with you and talk to you about some of the things, some of the thoughts that I have around policy development. I'm not a policy expert. I am a nurse. And I have been a nurse since I left school at the age of 18. When I say I'm not a policy expert, but I'm a nurse, I think nurses have a huge role in policy and have a huge expertise in policy. And one of the things that I'd like to come across in my presentation is the influence that they do have and the opportunity for further influence they have in policy development. And so what I want to do is to kind of give you my thoughts and perspectives on having worked in a number of different roles within the NHS, about how we can influence policy development even further, and perhaps give some examples of some of the work that I've been involved with and continue to be involved with that impacts policy. Now, I'm hoping that we'll be able to share the slides in a second. I don't know if people can see them yet or not. There we go, lovely. So if we go to the first slide, thanks, Adam. I'm going to be like Chris Whitty for the rest of this session. So this slide, I thought it'd be interesting to just give you a bit about kind of me, my career, and how I've ended up here. And I think this is really important because one of my reflections when pulling together this presentation was that actually I've been involved in policy since the start of my career, and I probably didn't realise that until a certain way through my career, actually. So you'll see here kind of a number of different roles, different places that I've worked in. So one of the great things that I've been able to do is to work at organisational level. You'll see I started as a Started my training back in Swansea at the age of 18 as a student nurse, worked in a number of different organisations in different places. I did my MSc in healthcare practice, which had actually quite a large policy focus as part of it. And also have done roles both at kind of organisational level and also at regional level. I was the regional chief nurse for the South East, mostly during the pandemic, actually. Which gave them real insights into policy development, particularly rapid policy development, given the way in which things have happened over the last period of time, and insights into that. And then most recently, since April, I've been the Deputy Chief Nursing Officer for England. And if we move to the next slide, just to give you, Gemma did say a bit about my portfolio, but that has expanded again, Gemma, since we last spoke. So that's how we roll. But what my portfolio allows me to do is to have a really great opportunity to influence a number of different policy areas and work with some absolutely fantastic people that are up and down the country influencing the policy in these areas and the approach that we're taking to drive improvement. Because I think the most important thing about any policy work is actually what the result of that is, and the importance, therefore, of using it to drive improvement. So, as Gemma said, one of the areas I'm supporting is the national team and the Chief Midwifery Officer and the National Clinical Director for obstetrics in terms of maternity operations. Somebody said to me the other day, does that mean you're doing all the cesarean sections? No, it doesn't. It means that I'm supporting some of the operational work and the delivery side of maternity services and the maternity transformation programme. And I'll talk a little bit about some of that work as an example around some of the policy work that's going on at the moment. Big focus on workforce. As Gemma said, International Nurse Recruitment Programme, which is part of the government's 50,000 manifesto commitment. And again, when we talk about policy and politics, I'll reflect a little bit on that in a moment. The National Healthcare Support Worker Programme, and the Children and Young People's Transformation Programme as well, which is trying to make improvements in the outcomes and services for children and young people, particularly really important at the moment, a particular area of focus nationally because of the impact of the pandemic on children and young people, as many of you will know. So a real opportunity there, I think, to influence what we're doing in this space. And then since last Monday, I've taken on infection prevention and control as Sue Trank has moved on to be the Chief Nurse of Wales, which is great. And then many more things that you get involved in, which is one of the reasons I love this job so much. So if we move on to the next slide, just here's a little, what is policy? And I've picked out a few things in here which I think are really important, because policy does not sit in isolation from the world in which we work and the world of delivery and ensuring we make improvements. So, it's a set of ideas or a plan. It really applies to what particular situations. And I think that's an important bit just to hold in terms of how we think nationally. How do we roll out the implications of policies, and how does that apply to the many different situations in which people work, in which they live, and which they operate? And then, how do we bring together groups to agree the approach and the policy that we're working on, whether that's a kind of organizational level, and that, as I've said, working at different levels, whether that's a kind of regional level, whether that's in a trust, or increasingly actually in an integrated care system. And I think that's an important thing to reflect upon, the influence that we have within integrated care systems, or a governmental level or political party type level. So if we move on to the next slide. So as I say, I'm not an expert. I'm not going to spend the next half an hour going on about policy models, because that's not my area of expertise. But I think one of the reflections that I had when I was putting this presentation together is that this policy, this is one of the kind of models that exists for policy development. It's very similar to the nursing process. It's very similar to that kind of planning approach, that implementation, the evaluation. And so, this is not a It's not a, this is a cyclical thing. This is a thing where, you know, we will, you know, develop policy, we'll tweak it, we'll evaluate it, we'll implement it, and we will go back around the cycle. So it's not a thing that is static. This is live. And therefore, the way in which we develop policies at whatever level has to be responsive to the circumstances and be flexible enough to move and keep with the times. So if we move to the next slide. So that's clearly an NG tube. So I was reflecting on when did I first get involved in policy? And I was thinking back to a role that I had. I was a junior charge nurse, so an F grade, back in the RUH in Bath, and I helped set up the stroke unit there. This was back in the early 2000s, when particularly the outcomes for people with a stroke were extremely poor. This is the days before HCSW and thrombolysis. But clearly there was a move to improve the care of people with strokes. And one of the things that I noticed was the delay for people receiving NG feeding, because weekends, you know, obviously decisions around who would start a feed, and therefore, you know, I wanted to do something about it. You know, how do we get then an emergency feeding policy in place? How do we get an emergency feeding approach that allowed those people that were around at the weekend to be able to start to ensure nutrition for people that have been brought in with a stroke? And so my reflection on that is that it is so important. Policy is about doing things that make improvements. And therefore, when I reflect, nurses and midwives and healthcare professionals are influencing policy every single day. What I don't want people to think about is that policy only exists in the top of NHS improvement or the government, etc. But there are things that happen every single day in terms of improving clinical practice that are about influencing a change in policy, a change in practice. And that for me was one of the first examples where I think I made a big difference to try and improve the care of patients by influencing a policy. So if we move to the next slide. So one of my other reflections, so one of the loveliest jobs I had was the Director of Nursing at Kingston Hospital, where I was there for about 4 years. And one of the things that was really important to Kingston Hospital, because of its local population, has an aging population, lots of people with dementia in the community, and therefore coming into the hospital setting. And so we did lots of things to try and improve the care of people with dementia in that hospital. And one of the reflections around how do you develop policy and how do you influence policy is that sometimes you need to make incremental changes to get to where you want to. And so that's a kind of collection of incremental policy changes. So one of the lovely, you know, you can see in this picture, somebody with a dog. That was one of the pet therapy dogs. And I use this as an example because trying to shift the policy in an organization around it's okay to bring pet therapy dogs into an adult area. Interestingly, you know, lots of children's areas have had this for years, but trying to make that shift, really, really interesting kind of how you make that happen. How do you provide the evidence that, you know, this isn't going to result in lots of infection control issues, etc., but makes a real change in terms of the outcomes for patients and actually for improving the morale of staff. But we did a number of things like that. Then we opened up visiting, you know, open visiting policies. You'll see a picture there of some of the improvements that we made in the ward environment. So, you know, we changed the policy and the approach to what's the expectation around a clinical environment in that hospital. And from all of that work, we were able to go out and talk at conferences about the work that we did, very interesting, actually. I spoke at a conference about the fact that we were putting pet therapy dogs into adult areas, and a lot of reaction actually from some organizations who wouldn't allow it. So there's an interesting kind of reflection for me then in terms of at that organizational level where I could influence things. How do you then influence things at a bigger scale? And I was really delighted to be invited to go and speak at an all parliamentary group on dementia, and that's a copy of the report there, of which I was a contributor to, talking about the work that we did at Kingston Hospital on dementia. And so the thing I would say from this is, one of the things that I particularly took away is the importance actually of talking about the work that you're doing, sharing that, going to conferences and talking about it. Some of this stuff is that, you know, you may feel as though it doesn't make an immediate change in national policy. It doesn't make an immediate change in a big visible change. But one of the things that kind of making these incremental step changes, conversations, it sparks things in other people. It creates a movement. So, you know, on the back of talking at conferences around the work we were doing, the number of people that made contact, the number of people that wanted to try and adopt some of this stuff. So some of the stuff around how do we make a change in policy is how do we kind of progress things, how do we present it, how do we talk about it, and not being afraid to do that, and then taking the opportunity. So going to that all parliamentary group back in probably about 2015, 16 was terrifying for me. I have never been to the House of Commons. I have never gone to be interviewed and by a committee of MPs. It was an absolutely terrifying experience for me, but I'm so glad I did it because it's really important. And that's for me is kind of one of the things I would say to anybody on this session today is almost face your fears around this, because it's important that we do get over that fear of doing this, because you know you have an expertise, you have the expertise in the improvement work that you're doing. If we move on to the next slide. So the other thing that I've really learned as a director of nursing, so I don't know how I managed to get a Loch Ness monster in the presentation, but I'm glad I did, but is beware the mythical policy. And I say that because one of the things that I've come across, and it'd be great, actually, I'm sure that many of you will have examples of the mythical policy, which is people believe that there are policies in place for things. They believe, therefore, that I can't do this or nurses can't do this because of a policy that they believe exists, or a policy that's existed for many, many years, which is historic, which is out of date, which needs to be challenged, which restricts the way in which we practice. And so, you know, many of the things that, particularly as a director of nursing, I've come across this in many ways is based on, you know, an incident that happened 20 years ago. A policy was formed and has never been revisited. So I would challenge everybody, look for your mythical policies, look for, try and really challenge that and understand it. Is it myth? Is it reality? And therefore, how do we move things forward? And then, you know, the other myth I think is out there, as I've said before, is that policy exists only over there. And when I was first starting out as a nurse, and for many years actually kind of believed that it was other people that did that. It was other people that sorted out policy. That wasn't wasn't me. I had no influence over it. But every single nurse and midwife in the UK has influence over policy. And that is one of the strongest messages I would like to leave with people. So look for your Loch Ness monsters and go and challenge them and go and find them and do something about it. And I guess that leads on to the next point in the next slide, which is around speaking truth to power. And I think one of the things I've found as I've become more confident as a nurse and also as in leadership roles is the ability to speak truth to power, and the importance actually of speaking truth to power, but not just saying what's wrong, because I think it can be very easy to fall into the trap around what is wrong with everything. And, you know, and I've been guilty of that in the past as well. You know, it's very easy to say the list of things that need improving. But the thing that goes with speaking truth to power is also about how you speak about purpose, how you speak about what can be done about it, what are the ideas, the thoughts in which to progress that. So all of those elements are key components of speaking truth to power and being able to articulate a position. And one of the things that I reflect on is that I often have to do that. And you have to really know the audience that you're speaking truth to. Because one of the things that you have to be really mindful of, and I'll talk a little bit more about it in a moment, is the impact of what you say, and also trying to understand the perspective of who you may be speaking to or talking to about this to influence a policy, for example. So if we move on to the next slide. So one of the things I think it's really important to also reflect upon is how we come up with policies. Where does all of these things come from? And, you know, we'll talk a little bit more about politics, and we'll talk about kind of other things. But I think it's really important to reflect upon the importance of best practice and research. And obviously, this is May Parsons, who is giving the first vaccine in the world, actually, in terms of COVID, and what this does is really reflect, I think, the importance of research. You know, we've seen this massive research program for COVID, and nurses have been part of that throughout. And the importance, therefore, of the work that's done in academic institutions, that's done across our networks, that are done in organisations around developing what best practice looks like, what does the research say to try and influence changes in policy and approach. And therefore, I think it's really important as nursing and midwifery leaders that we reflect upon the importance of research and increasing the amount that we're doing to try and shift the agenda and shift the way in which we provide care, and therefore the policies that support that. So if we move to the next slide. So one of the biggest lessons I think I have learned throughout my career is the importance. You cannot underestimate the importance of building relationships, and the importance of building relationships outside of your kind of visible sphere of people. So, you know, one of the things that I've really learned actually in doing the national role and the regional job, and increasingly throughout kind of my career, is the importance of getting to know people, getting to understand their perspectives. You know, so I spend a lot of time in some of the programs that I do working with the Department of Health and Social Care. So it's really important for me to have good relationships with those colleagues, so that we can collaborate together and so that we can deliver on all of the things that we're trying to deliver on, be it, you know, work around maternity transformation, be it work around international nurse recruitment, whatever it is. But you have to build those relationships. So it takes time, it takes energy, it takes curiosity. So really trying to understand the perspectives from other stakeholders. So I would say to everybody on this call, reflect upon the amount of time that you spend building relationships, and think about the people that you might need to build a relationship that aren't obvious to you. So who are the people that can influence things in a different way? So you know, and maybe go out and find somebody to build a relationship with in a different way than you would normally. So it's not all about actually nurses and midwives and building relationships with nurses and midwives. That's absolutely important. But, you know, increasingly the work I do around maternity transformation programs, you know, there's the work with the ICSs, there's the work with the local maternity system leads, there's the work that we do with national colleagues. There's lots of work around maternity voices partnerships, so there's those groups that we work with. So really think about, one of the things that whenever I'm thinking about the implementation of a policy, think, who are the people, who are the stakeholders, who are the people that we need to connect with. So if we move on to the next slide, I'm going to do a little exercise with people in a moment, actually, just to kind of get a bit of input. But I don't know if anybody knows where this is. This is the Church of the Nativity in Bethlehem. And one of the things that I had a light bulb moment, actually, in a leadership program back in 2009, when I was really lucky to go on the Aspiring Directors of Nursing program that NHS London was running at the time. It was a fantastic program, and we had the chief negotiator from the siege of the Church of the Nativity back in 2002, who, there was a film that was made, there's a documentary that was made by the BBC behind the scenes on this negotiation. And he had the group of, it was about 10 of us, 10 aspiring nurse directors in a room, and split us into different groups. And he played this documentary that was made and paused it at certain points and got each of the, I think it was 4 groups at the time, to take the perspective of a different group of people. So, group of 3 of us who were the Palestinians. There was a group of 3 of us who were the Israelis. There was a group of 3 of us who were the international community. And what that really did for me was to make me think about, put myself in the shoes of that other group of people, that other stakeholder, the other party, to really think, what would their perspective be on this? And so when thinking about policy, and when thinking about developing and defining and bringing together policies, how do we really try and understand the perspectives that other people will be coming from? Because we might think it's a great idea, we might think this is the best way to do it, but actually, how do we really try and get in the heads of other people? So if we move on to the next slide, I had a bit, and I keep having light bulb moments, don't I? But there was a moment actually recently. I don't know if anybody's seen the series Hospital, and there was one that was recently done actually a few months ago. It was filming behind the scenes in Coventry, and this was during wave 2 in COVID. And I was watching it because I knew that there was going to be an item on all of the nurses from India that they'd been recruiting during the pandemic. And there was a moment where a senior nurse on that was talking about a policy that we had just participated in, that had just been issued out by the government to say, we're going to pause the recruitment of nurses from India when the really difficult pandemic impact was happening in India. And so, interestingly, I was kind of, it was a moment when I thought, well, actually, hang on a minute, I've been involved in that. And that's now kind of translated onto what was happening in that clinical area, and that individual trying to support that at local level. But so we had to suspend the recruitment temporarily of nurses from India. And if we go on to the next slide, what I just wonder, whether if we've got a couple of minutes really, is for people to think about the different perspectives there. So, what would the perspective in terms of trying to make that decision of the nurses that were waiting in India might be? What would be the perspective potentially of, if we made that decision, or the government made that decision, of the Indian government? What would their perspective be? What would be the perspective of the media if we carried on recruiting nurses from India? What would the perception of the NHS be? So I just wondered whether we could just stop there and just if anybody feels comfortable to give us a kind of view of what they think a perspective of the nurses that were waiting in India might have been.
Thanks, Duncan. So either you can pop your comments into the chat box, or if you feel brave enough, you're very welcome to speak and share your perspective. If you want to pop your hand up, just for those of you that are not used to Zoom, it's under reactions. So if you go down to the bottom of your screen, you'll see the toolbar. And if you hover over and click on reactions, there's an option to raise your hand. So we've got Bongi.
Thank you, Duncan. And yes, imagining the perspectives, absolutely. Putting on my policy hat, I would say what would have come maybe on top from the global community is the questions around the WHO ethical code for international recruitment, which at times tends to be mythically judged because in terms of England, the UK is actually doing more than what is contained on the WHO International Code for Healthcare Recruitment. So that would have been an issue around taking nurses. It would be saying in conditions taking nurses from a country that is having the impact of COVID, and obviously that's a negative impact on the NHS as an organization, and when it's known as a kite mark for healthcare systems across the world, that would have been my major perspective that I would have been looking at, really. That's what I can say to share for now.
Thank you. Thank you. Did you want to respond to that, Duncan, at all?
No, I think you're right. I mean, I think you know, Bongi makes a good point, because a lot of this is about weighing up what's out there already, what's there in existence in terms of policy, what's there in terms of perception. So you know, I think that this is one of the things that we have to do in terms of decisions around policy, and some of them are, you know, we have to make quite rapidly sometimes, particularly given the pandemic. So kind of, what do we sit within a framework such as the WHO international recruitment program policy? So I think, you know, this is really I guess the kind of point that I wanted to make is there's lots of different perspectives on this. So, you know, we have to think around what's the impact, for example, on a nurse that might be sitting overseas, and that impact on that delay of them. What's the impact then in terms of continuing to recruit individuals on the wider country, which might be in difficulty. So all of these things have to be weighed up. And perhaps if we move on to the next slide, we can just move on to the next one, just to give you a sense of, and one of the things I want to try and get across is the sense of the number of people that often, or organizations, that you have to take into account in terms of policy decisions. Now, this is just that policy decision alone around putting a pause on nurses from India. And I probably haven't even covered everybody on this. And, you know, if you think about NHS improvement in England, there are multiple people and multiple parts of that you will need to involve and consult around any decisions such as this. You've got, you know, particularly with international recruitment, the work with the Foreign Commonwealth Office, you know, the impact with unions, the Nursing Midwifery Council, because any decision that we make may have a knock-on effect in terms of somebody's ability and the timelines around their NMC process, for example. What impact does that have on visas? So some of the work that you have to do around policy, very much thinking around who do you need to engage, who do you need to involve in terms of the decision, who do you need to communicate with, who do you need to consult with, and what's the potential unintended consequence or impact, both to individuals or organizations or systems, or the health of the population or patients on these decisions. So the complexity, one of my reflections around kind of moving from trust to region to system, is the complexity grows and the number of organizations that you consult grows. And one of the things I would also reflect on is you quite often forget somebody, or you quite often forget an organization, and that's not deliberate. It's just sometimes you don't necessarily think, you might need to think about that. So that's why the kind of stakeholder management, why the connections that you have through different organizations open up the doors to those conversations and consultations. So I guess I just wanted to get across some of the kind of different complexity here, and the importance therefore of involving lots of different people in these decisions. So the thing I'll just move on to next then is really the importance about actively, if we move on to the next slide, actively seeking out an alternative view. So really, really important that we avoid groupthink in policy development. Really important that we actively go and find the people that are going to tell us that this policy is not going to work, or it's going to be, you need to do this to it, or this will be the impact, you haven't thought about the impact of this. And I say that because when things don't go well in terms of policy implementation, you could have probably found that out from making sure that there's different perspectives. So, you know, one of the things that's really helpful in some of the programs that we're now running nationally is the shared decision councils. So really understanding the voice and perspectives of different people in service to understand, so we can test things out. You know, we've got a very active group of directors of nursing. You know, I will go to, there are people I will go to who I know will tell me how it is and how it will give me a really honest view. And that's not always comfortable to hear, actually, when you think, you know, you've done a huge amount of work, but it's really important that that ability to go and find people and pick it apart to help improve the decisions that you're making and the policy that you're formulating. And if we go on to the next slide, I don't know if anybody's seen the movie World War Z. You might not have, you might have. That's a clip from that. There's an interesting part in this, which is they talk about the 10th man, and actually this is a real thing. So in Israel, this is the part that's in the movie where they're talking about the wars that happened in 1972 in Israel, and there was some decisions. There was a decision taken there for, you know, a 10th man. So if 9 people agree on something, it's the job of the 10th person to give a completely different perspective and for people to listen to that. So whatever mechanisms you have in place, whether it's that type of approach, whether it's a red team where people deliberately kind of take a focus and pick apart your policy and, you know, look at what the unintended consequences or the risks are, really important that you find a mechanism in developing policy which actively looks at it from a different perspective or different perspectives. And if we move on to the next slide, then I've talked about influence a bit, but I think one of the things that's therefore really important in terms of seeking those alternative views as well is how you're not necessarily the one that needs to influence everybody in this, but find the people that have perhaps a more powerful influence over something. So you know, there are lots of people that support nursing and midwifery policy, health policy development. You know, we work a lot with people in the government. We work a lot of people, you know, there are people that work support in the House of Lords, for example, that will work with us. We have some great people that work with us that sit in the Lords on maternity, for example, and so have lots of conversations with them about the work they're doing. They will influence us about the things that need to happen. So it's a two-way process, but try and find those people that might have more influence than you on a policy decision and actively engage with them. So, you know, it's again thinking about those stakeholders, thinking about who they are, but thinking about who might have more of an impact. So often, you know, I will have conversations with people to have a conversation with others because that will have more of an impact than me going directly to them to do it. So just think about the kind of nuance of who's best to have to try and influence people. And then if we move to the next slide, I think one of the things that's really starkly come into focus, as people will know, during the pandemic more than ever, is inequalities. So I cannot, I guess, overemphasize the importance of looking through any policy development through the eyes of inequalities. And so you'll see there, so we're very heavily involved in the maternity programme at the moment. And we know that the outcomes for women and babies from Black and minority ethnic communities are worse. And also those from deprived areas. So the most deprived women are twice as likely to have a stillbirth as the least deprived. And the stillbirth rate for Black women is over twice as high, and for Asian women 1.5 times as high. So in terms of the policy, in terms of the implementation of that, we've really got to take into consideration what we need to do, and the impact potentially on health inequalities. And, you know, I've got a rainbow flag there. I'm a gay man, and, you know, therefore, you know, I will often, because this is the perspective that I will bring to something, and therefore that importance of bringing other perspectives is really important. You know, I know the fact that, you know, I think it's Stonewall say, you know, 1 in 6 people that identify as LGBT find it difficult to engage with health services. So, you know, what are we doing to try and address that? And so we all come at these things with different perspectives, but actually, how do we make sure those different perspectives translate into the way in which we drive and develop policy? We've moved to the next slide. Politics. So obviously this is kind of, you know, we don't live in a world, the NHS doesn't live in a world where we're separate to politics and politicians and, you know, the political narrative and objectives. So it's really important, as I say, you know, again, this is about how do you and how do we as nurses influence in a political space. You know, there are nurses working in many different environments, and there are nurses that are MPs as well. And so it is our job to try and influence and steer the implementation of policy. So, you know, I and colleagues will work with colleagues at the Department of Health and, you know, Secretary of State and others on influencing policy. So one of the things, again, that's no different from what I've said before, we really need to try and understand the perspective. So understand what the motivations potentially are. I think everybody wants to try and make improvement, but what are the particular motivations for a particular policy decision or a particular direction? One of the things that I do think is really important, though, in this space is about how do you, is delivery, is making sure that there's clear delivery on policy and also milestones and goals, because that's a really important thing for people to see. So if we move on to the next slide. And similarly, media. You can't, and particularly, and I've put social media here as well because it's a big influencer. And therefore, you know, again, the world of policy development is not immune from the impact of media or the impact of social media either, and increasingly so. We see that in terms of the ability for people to have a voice, which I think is really important. I think, you know, there's many positives around social media. There's clearly some negatives as well, but many positives in terms of ability of people to have a voice and an opinion and raise that opinion to try and influence policy. And we see many nurses and midwives using that as a forum to influence, and people do take and do listen to it. If we just move on, one of the other things that I just wanted to reflect upon is working at a national level really is the complexity of working at a national level. So, you know, one of the things I kind of learned very quickly in the Southeast was, you know, we've got an island community in the Isle of Wight, and what might work on the mainland and what might work in an island community where there may be less clinical staff, there's a boat to get people across to the island onto the mainland, may not be the same as what works in London or Oxford, or what's the travel time. So the complexity, so any policy decision or policy development has to take in consideration those local circumstances, the ability to flex to those local circumstances. So whether it works in an urban or a rural setting. And, you know, so just as if we move on to the next slide, just as an example here, we're doing quite a lot of work at the moment testing out international recruitment in community services. And we've done that deliberately in a mix of urban and rural settings, to really trying to understand what interventions, what policy decisions we might need to influence to make an impact in those different various places. So you really have to think around policy that might impact whether you're up in Newcastle or whether you're in, in the middle of a rural area in the southwest of England. And so kind of one of the things that I've really learned during my kind of time in the region and also now nationally is about that variation and what do we need to do to try and address that. And then if we just move on 2 slides, I just wanted to kind of talk about why policies fail, because I think it's really important to understand that. So you can see a number of different things here, but I think some of the important things really are about not thinking about the implementation sufficiently. So whether that's the kind of how long it's going to take, the lack of measurement around that, how we communicate things, being clear about the ownership of implementation and policy development, or insufficient resourcing. And I'll come on just a little moment just to talk about resourcing, because I think it's a really important point in terms of any moving and progressing policies. And the point I was just making around the kind of the rural and urban, that lack of adaptability. So we've got to make sure there's adaptability to respond to those different circumstances and settings. And therefore, when we set policy or develop a policy, it's about how do we make sure we've got that the ability for people locally to make sure it fits the circumstances that in which they operate. So if we move on just for the last few slides then. So one of the important reflections is how do you pull the right levers? So how do you pull the right levers to make sure that policy lands in the right way? How do we implement really well? And so kind of some of the really key policy levers for me are around knowing how we're doing. So the importance of metrics and the importance of understanding the impact, the infrastructure that goes with it. So, what's the national, regional, local infrastructure that might be required, and some of that's about people, some of that's about resource in terms of funding that might be required, and then also about kind of how do you ensure that the ability to focus on this when people are trying to focus on so many different things. And just an example to give you on the next slide is the Healthcare Support Worker Programme. So one of the things that we've really tried to influence nationally in the Healthcare Support Worker Programme is not just recruiting lots of people out of social care. We don't work in isolation. And so what we don't want to do is to make vacancies in social care any different. But how do you get 200 organisations to adopt a policy of all recruiting or part recruiting from people that are new to care? So those people that don't necessarily have healthcare support worker experience. And some of my reflections of that, and we saw well over half of our new healthcare support workers recruited that were new to care. Some of that, I think, is about the resource that we put at it. So making sure that there was funding available and linking that resource to an expectation around people recruiting new to care, but also that resource being there to support people new to care. Clearly, there was a timing element of this. There was a lot of people out of work, and therefore, there was an opportunity to ensure that we provided employment to people that were affected by the pandemic. That's a responsibility I think we have as a healthcare provider to help people into employment because of the impact that we have on ill health. And also making sure we had regional oversight, we had weekly reporting of data, and so that we could monitor how we were doing. Lots of comms and lots of best practice examples being shared around the work that trusts were doing, fantastic work they were doing to support new individuals. So really think about, with any policy, the levers that will impact the things that you want to do. And then my last slide, because I'm conscious of time and it'd be good to get some questions in, is why nurses and midwives, I think, are really great at policy development, but we need to continue to do more of it. We need to continue to have that influence. So, we're all policymakers, we're all influencers, we're all implementers. We're really adaptable. We find ways to problem solve, critically think, search. You know, so one of my reflections is that we all have an opportunity here to continue to influence the development of policy, whether you're a staff nurse, whether you're a healthcare support worker, whether you're working as a director of nursing or wherever. We all can have an impact here. So I'm going to stop there. Hopefully that's covered the brief, but I'm very happy to take questions, thoughts or comments or differences of opinion, etc.
Wonderful. Thank you so much, Duncan. I've been keeping a close eye on the chat as you've been speaking, and it really feels like a lot of what you shared today is really chimed with our audience, particularly around how policy is ultimately around driving improvement, and that is the business of every nurse and midwife, no matter what level they're at in the organisation. And I think particularly people enjoyed your reflections on how relationships are so key to that, and really what changes as you move through regional, local, regional, national roles is who those relationships are with, and the complexity of those relationships, but always that's at the heart. There was a comment that came from Samantha early on in your presentation. Samantha reflected on being new into a policy role and feeling like a fish out of water. And you described about facing your fears the first time you were presented with that opportunity to go to the Houses of Parliament. I wondered if you've got any thoughts around how we can step into that authority and really have that influence that you've described.
Yeah, absolutely, and thanks for the question. I think reach out to somebody and go with somebody for the first time. You know, I felt really sick the first time I had to present to one of the ministers about the programme. Well, this was last year, and I was really, you know, I went with Ruth May, and you know, for the first time, and you know, helped me understand, and I observed and I watched. So I would say reach out to somebody and go with them to one of those things. People really don't mind being asked for that, but it's a good way to kind of break down some of the perceptions, because often I think, and I've been guilty of this, you think it's going to be worse, or you think it's going to be more difficult than it actually is. And so some of it is about observing, I think.
Yeah, and I guess again, people, so relationships are central to that. It's about understanding their agenda and what's going to really catch their attention, so they listen to the points that you've got to make. Absolutely. And I wondered myself around how you've adapted, particularly in your role as the International Nursing Recruitment Lead, to think more about global policy. So thinking more widely around how different political systems and cultures might influence your policy work.
Yeah, absolutely. I think this is one of the areas which I probably had very little to do with. Gemma, but was been really kind of one of the, I would say the approach that I've taken is to try and understand, to connect with people that know. So we've got some fantastic colleagues that work at the Department of Health, one of which has been all around the globe, has worked as part of their work in embassies, really understands that kind of global politics, the nuance around different political systems in different countries, and how that works. So, you know, again, I have no shame in asking, in finding out about that. You know, I think also, you know, one of the great things about working with the Florence Nightingale Foundation is that we've been exploring that together. We've also, one of the nicest things that we've been able to do is to bring together the international nursing associations and their leadership, because they give such a different perspective and a greater degree of understanding about, you know, if we're recruiting nurses from India, or, you know, there's an agreement that's just been signed with Kenya. So we're doing some work around recruiting nurses from Kenya. So kind of understanding what nursing is like there.
And just really finally to say, Duncan, as we have run out of time, the great theme that's been running through all of the comments has been around that very grounded and practical perspective that you've given on policy making. Is there any final comments that you want to make around that view?
Sorry, Gemma, could you say that again?
Yes.
Slightly.
Yes. Sorry. Just a really strong theme that's been coming through the comments is around your very grounded and practical approach to influencing policy. Is there anything further or messages that you want to give to the audience?
Yeah, I can just pick up on a comment that that's just been made in the chat box by June, because I think that is really important about, does a patient have a role in policy development? Absolutely. And I think, you know, how do we put the structures in place, for example, through maternity, where we've got the maternity voices partnerships? How do we make sure that that really comes through strongly? And again, it's about how do we hear the voices and really hear, and make sure that with any kind of policy development, we think about how do we make it easy for people to participate in that, and also just reflecting on the inequalities element as well.
Absolutely. So we've got a real sense of that grounded nature of this work, that it means something to the people who it's going to be influencing. Well, I just want to say a massive thank you to you, Duncan, and also to our audience for engaging with us and sharing with us your own insights on these topics that we've discussed. I think what we've taken away is a really kind of demystified approach to policy development that feels very accessible to all of us, and we can all be thinking now about how we're currently already influencing that policy arena, but also what more we could do to step into that space and influence and have that authority that our expertise offers us. So thank you so much for your time. Thank you, everybody. And we will make sure that all of your questions get passed on to Duncan so he can see your feedback and comments. Thank you all.